Okay, so in this video, I'm going to be protecting a patient from aspirations or showing how to prevent aspirations. So I'm going to, first, I'm going to go ahead and raise the head of my patient's bed. Patient can be positioned in an upright seated position with their feet on the floor at like 90 degrees, or in their bed sitting upright. Okay. If the patient has oral medications, I'm going to allow the patient to self-administer their medications. I would look for signs of dysphagia, which would be difficulty swallowing, delayed swallowing, an incomplete incomplete oral clearance or pocketing of food, regurgitation. I would make sure that I assess the patient's gag reflex. I could offer them 50 milliliters of water and do that in 5 milliliter allotments, and stopping if the patient begins to cough. I could administer pillows one at a time to help prop up their head, and then just ensure that the medication is swallowed properly before I would give them another oral medication. I could thicken regular liquids or offer fruit nectars if the patient cannot tolerate the thin liquids. I can also crush or mix some medications into like pureed fruit. I would avoid straws because they can decrease the control the patient has over the volume of intake, which also can increase risk of aspiration. I would have the patient hold and drink from a cup if possible. I don't have one, so we can't really show that. And I would time medications to coincide with meal times or when patient is well rested or awake if possible. And I would also administer medications using another route if risk of aspiration is severe.